Thank you, Christina. We are so excited to be a part of this really important inaugural day today and to be here on this panel. I'm going to go ahead and share my screen and introduce the panel and the panelists. Okay, can I get a thumbs up that this looks, oh, you can see it? Okay, great. So our panel is titled Resources and Research Update. And we have, there's 4 of us today, 5 of us actually. I'm confused actually. So I will get to each person. There's no problem counting. We will be talking about resources available through PSI, as well as important research updates happening on a national level from Mass General. And we're going to take turns going through. I'll introduce each speaker before they speak. I'm going to just start with an overview of the resources available through PSI and then turn it over to Talia. In terms of postpartum psychosis, there's several initiatives and many people working very hard through PSI. Before we get into that, I wanted to just acknowledge cherishedmom.org, Christina's organization, who works closely with Postpartum Support International and who brought us this day today, Postpartum Psychosis Awareness Day, which is such a massive resource and important day to raise awareness and bring attention. In addition to that, we have Postpartum Support International, which I'll refer to as PSI, the website postpartum.net. The website is just such a wealth of information. There's links to resources for education and support, lists of local providers, coordinators, trainings, intensive treatment centers. This is a great place to go for anyone who needs more information and wants to know where to start getting help for postpartum psychosis. PSI also has several specialized coordinators. These are the postpartum psychosis coordinators. These are folks with expertise in perinatal psychosis. They help people find local services, answer questions for family members and consumers and providers, and support moms and others on the journey to recovery. These specialized coordinators are available around the clock. There's many of them scattered around the country, very eager to provide assistance. PSI offers many peer support groups, and Talia is going to go into great detail on this. I just wanted to mention that there's a perinatal psychosis group that meets weekly and a group for family members and loved ones that meets monthly, virtually. PSI also has a perinatal psychosis task force, a group of many devoted folks who work on awareness and advocacy. There's committees and projects. There's a small group of officers within the task force, and then there's a large group of participants who help make the initiatives happen. And reaching out to Sharon Gertis or Wendy Davis for folks who are interested in finding out more about helping the task force. PSI also has on the website and through specific folks who are experts, a legal resources toolkit available to help folks who are navigating the legal system related to perinatal psychosis, as well as media resources and support. Should a tragedy occur, there are resources to help with the interface with media. This is just a small list of what is available. And then very exciting, officially announced today, but still a bit of a soft launch, the Maternal Mental Health Hotline, a collaboration between HRSA and PSI, will now be available as a 24/7 hotline with trained counselors ready to take calls and texts from any person or person caring for someone with a mental health challenge during pregnancy, postpartum, infertility, or loss. So this is a really exciting resource that's going to be available. I'm going to turn it over to Talia now. Oh, before I do that, can I do an introduction? Talia Bryan is here with us. We're so fortunate. She is passionate about maternal health, reproductive justice, and she's an avid supporter of breastfeeding. She's a certified holistic birth doula, a lactation educator, and a support group coordinator for PSI. Talia splits her time between being an active birth worker in the field and assisting families within the virtual support groups realm and other resources PSI offers. Today, she is going to talk to us about the available resources and groups through PSI, as well as the mental health experience of BIPOC people. Talia, thank you.
Thank you so much, Felice. I'm so excited to be a part of this conversation and just to continue to spread the word about the PSI resources, but then also speak on the Black maternal health disparities and how that plays a role within the psychosis world as well. So I would be remiss if I didn't speak on these disparities and how it plays a role in the lack of diagnosis within the Black bodies that may experience perinatal psychosis, and that there is a lack of research, data, and voices amplifying this disorder within the Black community. So it's important to note that Black women are 3 times more likely to die from pregnancy-related causes than white women. These factors that contribute to these disparities include access to quality healthcare, underlying chronic conditions, structural racism, and implicit biases. Social determinants of health preventing many people from racial and ethnicity minority groups from having fair access to economic, physical, and emotional health. In the United States, Black women experience unacceptably poor maternal health outcomes, including disproportionately high rates of death related to pregnancy and childbirth. Both societal and health systems contribute to these high rates of poor health outcomes and maternal mortality in Black women, who are more likely to face and experience these barriers to obtaining quality healthcare and often face racial discrimination throughout their lives. We see this in the lack of data like I expressed in Black and brown women who experience psychosis and do not receive proper diagnosis for their condition either prior to birth or after childbirth. Due to racism, sexism, and other systemic barriers that have contributed to income inequality, Black women are typically paid less than to white and Hispanic men. These median wages for Black women in the United States are about $36,000, which is $21,000 less than the median wages for white non-Hispanic men. When looking at these wages that Black women are receiving within their different parts of, depending on where they are falling into their job criteria, families are having less money to support themselves and their families, which then trickles into their access of care for getting insurance, essential resources like housing, childcare, food, and healthcare. What's important to note is that many of these Black women and brown women as well have difficulty time accessing reproductive healthcare that meets their needs. So in order for us to move the needle, continue to have these conversations and really see the improvisation in healthcare for Black women, we need a multifaceted approach that addresses Black women's health across lifespans, improvisation and improving access to quality healthcare, addressing social determinants of health, and providing greater economic security. I just wanted to mention those because when we're talking about maternal mental health, perinatal mental health, and specifically for this particular group, psychosis, I would be remiss if I didn't speak on how these maternal mental health aspects affect Black and brown bodies. So I just want to speak on that first, and then now we can get into the resources. So with Postpartum Support International, we have our Facebook support group, which includes Postpartum Psychosis Forum and our also Postpartum Psychosis Survivor online support. We also have access to the Action on Postpartum Psychosis, APP. With Mass General, there is the Hospital Postpartum Psychosis Project. As Felice had mentioned, we have our PSI services, which includes the toll-free helpline, which offers support to women families in English and Spanish. Typically, when you call in, you will get a response back within 12 to 24 hours. Those that may be experiencing any type of suicide or suicidal thoughts, we definitely do mention to speak through the National Suicide Prevention Lifeline. As Felice had mentioned, we offer 2 support groups. We have the postpartum psychosis support for moms that's held every Monday night at 7:30 p.m. Eastern, where the focus, we have a lived experience survivor as well as a professional within the realm of psychosis. Then we also have our postpartum psychosis support group for family members, which meets the first Sunday of every month at 6:30 p.m. Eastern. Some of the feedback that we receive from help seekers that have joined either our psychosis mom group or for the family group includes some of the following. I appreciated the platform the moderator provided. It was truly a safe space and I felt comfortable sharing. I've never joined a support group before and I found it easy to participate authentically. The group has been the best part of my healing journey. I love seeing women who are farther from their episodes talk more about the ways in which they still grieve or the ways they have healed. It was great to laugh during this meeting, which is always helpful because our groups talk about really important topics. They can be really heartfelt and hard conversations, but to know that they provide solace is always something that we find near and dear. And it was a good meeting. It brought back up feelings, but it helped make me feel less alone in this situation. What's important to note about our support groups, whether it's the psychosis for moms or their family, is usually that in these times, members that join, it's either their first time really feeling that community with others or speaking with other people that have experienced a psychosis episode or diagnosis where they haven't before. So we really do find that our support groups are helpful to those that maybe are new within this community, weren't able to locate others that were experiencing the same symptoms or experiences as them, or just looking for other people to know that in this diagnosis, it is not becoming of who they are, but that they can be healed throughout the journey as well. And these are just some of the other PSI volunteer services. Police mentioned some of them, and I already covered a few of them, but I will go more into detail with them. So again, our helpline, toll-free number, which anyone can call or text if you're needing any type of information, support, or resources. It's staffed by our volunteers 7 days a week. And again, if you call or text, you'll get a response back within 12 to 24 hours. For our support coordinators, those are, we have those locally. So depending on where you are in the US or internationally, we're able to give you support. Find someone in your local area so that you can find additional resources. And then we have local, and then we have specialized. So that provides knowledgeable support specific to your diagnosis. Again, we have our online support groups that includes the psychosis survivors and then also for the families, but then we also have other perinatal mood and anxiety disorder groups, loss groups, fertility groups, Black Moms Connect and Black Loss groups as well. For our social media groups, we have our PSI closed Facebook group that is for peer support and educational purposes. They are non-clinical. Smart Patients, which is an online community for patients and their families. Users can be anonymous. Also, we have Chat with an Expert. So that's offered to moms and dads where it's free live. There's no registration required, and you feel free to connect with other parents, talk about resources, symptoms, and anything that you're experiencing with any of the perinatal mood and anxiety disorders, what we call PMADs. And then we also have our peer mentor group, which is pairs a parent in need of support with a trained volunteer that has experience and fully recovered from any of the PMADs, including psychosis.
Thank you, Talia.
Thank you.
So I am now going to have the honor of introducing Dr. Sally Wilson. She is not virtually here with us today. She was traveling, but she did send us a pre-recorded talk, which I'm going to share after I do her introduction. She is a part of APP, what we all know as APP, which is Action on Postpartum Psychosis out of the United Kingdom. Dr. Sally Wilson joined APP in 2019 and coordinates APP's workforce training and expert by experience talks talks for a range of health professionals across the UK. She was diagnosed with postpartum psychosis in 2015 after the birth of her daughter, Ella. And we're particularly excited to include Dr. Wilson's wisdom today, as it's APP is just really a wealth of resources and something that I think PSI admires in terms of the breadth and depth regarding perinatal psychosis. So we're excited to learn from her on the history of the organization and on some of their initiatives. So without further ado, I'm going to do my best to play a YouTube. Let's see.
My name is Sally Wilson, and I'm the National Training and Research Coordinator at Action on Postpartum Psychosis, or APP. So APP are the UK national charity that support women and families affected by postpartum psychosis. So
yeah,
we can't see the actual video. You may need to stop sharing and share the YouTube page.
okay. So let me do that. Can you see that?
It's a black screen for me.
Oh gosh. Okay.
Oh, there it is.
Oh, you see it?
Yep.
Okay, I'm going to go back to the beginning.
Great, thank you.
good afternoon. My name is Sally Wilson, and I'm the National Training and Research Coordinator for Action on Postpartum Psychosis, or APP. So APP are the UK national charity that support women and families affected by postpartum psychosis. So I'm going to talk to you today a bit about the charity, what APP does, the resources and services that it offers to women and families and health professionals. So just to start with, I'm going to talk a little bit about where APP came from. So APP has been a charity for 10 years now. It was our 10th anniversary last year. It's run by a team of academic experts and specialist clinicians and women and families with lived experience. So it's a true collaboration between lots of specialists. It began in the 1990s at Birmingham University in the UK. And it came out of a patient panel, really, research patient panel, where women and families were writing to academics and clinicians and talking about their experiences of postpartum psychosis. And from that, it was decided that women and families needed more evidence-based information and more support with the illness and the recovery. So it's still hosted by the University of Birmingham and supported by the National Centre for Mental Health at Cardiff University in the UK. So we have over 1,000 women members who have been affected by postpartum psychosis, and we also have over 3,000 online forum users, and I'll talk a little bit more about what the online forum is later. So over the last 10 years, we've made great changes nationally and starting to branch out internationally, increasing awareness of postpartum psychosis and reducing the stigma associated with the illness. I'm just going to talk to you a little bit about the different projects that we have at Action on Postpartum Psychosis. So it started out as a peer support charity, quite a small charity with a couple of people running it, and we've grown quite rapidly over the last 10 years. So it started with the online PP community forum, and that's manned by trained staff and peer support volunteers. And any woman or family member that's been affected by postpartum psychosis can go on there and ask questions about their experience. And they can ask anything, and then they can get replies and sort of share their experiences across that forum. We also have the one-to-one email, phone and video service. So that's where a woman or a family member can be matched to someone that's had similar experience to them, and they can offer peer support via one-to-one messaging or via phone or video. We have face-to-face peer support workers on the ground, so in different regions across the UK, either funded by grants or by the in partnership with the National Health Service. So we actually have women going into specialised mother and baby units and offering peer support to mums that are recovering. And we also have peer support workers going into the perinatal mental health community teams and supporting people in the community. We also have face-to-face APP cafe groups in some regions across the UK. So that's where women and family members can go meet in an informal space and a cafe space and talk about postpartum psychosis or anything else in life. It doesn't have to be about PP. So we have national peer support coordinators that kind of oversee those projects throughout the UK. We also have a partner peer support facilitator, Simon, assistant Chris, and some volunteers as well, trained volunteers. And really their role is to develop strategies to support partners of those affected by postpartum psychosis. So we have a private Facebook group for partners where there's lots of information and signposting going on there. And then they also offer one-to-one peer support for any partner affected by postpartum psychosis. So that just gives that partner hope, particularly in that time of crisis, if the mother's been admitted to inpatient care. Just before Christmas, we launched the online support group for grandparents, and that's where parents of women or partners that are affected by postpartum psychosis can talk to other grandparents about their experiences and support them through that way. Just want to talk to you a little bit about the power of peer support. So just in a recent APP survey, we found that 1 in 3 women said they might not be here today without APP's peer support. And I'm slightly biased because I'm one of those 3 people. So without the specialised signposting to the treatment that I needed at the time when I was ill, and without the peer support service, I probably wouldn't be here today talking to you. We also have an amazing team of volunteers across the UK and starting to branch out internationally as well. So we call those regional representatives or our volunteers. So they're on the ground in the UK and in some other countries as well, making links with organisations and perinatal services, giving training, building volunteer teams and fundraising and generally raising awareness. And we really couldn't do what we do without those volunteers across the country. We offer talks and training, so we have lived experience talks by our volunteers or regional representatives, and that's where we input into other people's perinatal mental health training. And we also have our own workforce training, so that's much more in depth, a day workshop where health professionals can come on and learn about postpartum psychosis. And since we started talking in 2014, we've reached nearly 14,500 health professionals across the UK. And during COVID times, we were able to branch out and we had some international health professionals, for example, from America and Canada coming on to our workforce training as well. We've got lots of information on our website. So lots of different sections about what PP is, what are the signs and symptoms, getting help, peer support, all the research that's going on, lots of news and events and about us as a charity. So lots of resources on that website. We've also got lots of specialist advice on there, so signposting to different organisations as well. We have our guides. So these are really great, quite short guides about things like recovery after postpartum psychosis, a guide for partners, and then a guide for those that are at risk of developing PP. And those were written in collaboration with women with lived experience and clinicians and academics. So that you can download those in PDF version off our website. And there's lots of different signposting to different resources there. But also involved heavily in campaigning, so making sure that all women can access the right treatment and care during pregnancy and postnatally. You may have heard of the Maternal Mental Health Alliance in the UK, so we align with their Everyone's Business campaign. So just as a bit of context, really, you can see here in 2015, this is where I live in North Wales. And at the time when I was ill, there was no provision, so no specialist perinatal community teams. And then over the years that has got better due to all the campaigning and the funding that's been put into the services. You can see here that a lot of England is now green, but we've still got some work to do in Scotland, Northern Ireland and in parts of Wales as well. And a part of that campaigning is about campaigning for mother and baby units across the UK. So this is again is a figure from the Maternal Mental Health Alliance, and you can see here that we have gaps in mother and baby units in Wales, in the Midlands, up in Scotland, and we don't have any in Northern Ireland. So we are very lucky to have specialist inpatient care where mothers can be kept with their babies, but we still continue to campaign to make sure that all women have access to this treatment across the UK. So we raise awareness within the media. So when the charity started, there was lots of stigmatizing storylines and things within the media. So we make sure that the right story gets out there within the media. And we started off as a patient research panel, and we continue to conduct research throughout the charity and help to facilitate other research within postpartum psychosis. I just want to give you a little bit of an example of some of the kind of research that we've done as a charity. So this was 10 years ago from an APP survey looking at the importance of mother and baby units. So we know anecdotally and through lived experience stories that it can be quite traumatic being separated from your baby. So we looked at the difference in outcomes in those that were treated in the mother and baby unit, specialised care, and we can see here that there was significantly better satisfaction with care, feeling more informed about the illness, support with recovery in those that were treated in MBU compared to a general psychiatric unit. And we can also see that the time to full recovery was a lot less within the mother and baby unit compared to the general psychiatric unit. So that was 10 years ago. We've now repeated this study, this survey, just before Christmas, and we're going to be looking at whether those outcomes have changed over the last 10 years. So I guess that leads us on to the future and what's next for APP. So we continue to provide award-winning and life-saving peer support for mums and families affected by postpartum psychosis. So we will continue to do that. These are just a couple of examples of campaigns that we've been involved in. So this one on the left is just during COVID, we were getting the message out there in terms of signs and symptoms of postpartum psychosis, making sure that mums were getting access to the treatment that they needed quickly. We've just launched this antenatal campaign this week as part of Maternal Mental Health Awareness Week. And that's really about talking about postpartum psychosis in antenatal classes and during pregnancy. And then I've mentioned already the APP 2021 survey. So that's now closed and we're in the process of analysing that data. So that'll just give us an idea about what's changed over the last 10 years in the UK. And really what moving forward, what the charity will decide to focus on over the next kind of 5-10 years and what's important to women and their families. And then I've just put on here that we've been working internationally over the last couple of years, making those connections and networking with organisations similar to ourselves across the world, and we'll continue to do that to make sure that we connect with all those different organisations. So this is just our website address and our main email address. And then we also have some social media accounts on Twitter, Facebook and Instagram. So Action on PP. We have lots of information and resources on there. And the other thing you can do is join our network. So that means that you'll receive a newsletter with all the updates from our campaigns and the work that we're doing in the UK and across the world as well. So I'm going to stop there and I'm going to say thank you for listening to me. And if you need anything from us, then please do get in contact with APP. Thank you for listening. Sally Wilson, and I'm the National Training and Research Coordinator.
Okay, I'm gonna do my best here. So before we move on, I think everyone really probably appreciated that talk we had from Dr. Sally Wilson. And I wanted to just put in the chat, she wrote to me and she wants to make sure that anyone who has questions reaches out to her at her email, which was on that last slide, but I'm gonna type it here. As well as she mentioned that the online peer support forum hosted by APP supports women and families affected by perinatal psychosis from across the world, not just the UK. And for anyone who's interested in joining that forum, this is the website, health. Bear with me. Let me get it right. Okay, so that is there in the chat for anyone who's interested. And please reply if there's more questions. Okay, so I'm going to go back to our slides. And we're going to, let's see, can you see this?
Yes, we can.
Okay, let's see. Sometimes the Zoom bar blocks what I need. So our fourth and final panelist today is Dr. Lee Cohen. Dr. Cohen is the director of the Aman Pinizzato Center for Women's Mental Health at Massachusetts General Hospital. He is also the Edmund and Carol Carpenter Professor of Psychiatry at Harvard Medical School. He is a national and international leader in the field of women's mental health and was among the founders of the field of perinatal and reproductive psychiatry. So Dr. Cohen, I'm going to turn it over to you, and I'm going to stop sharing my screen so that you can share yours.
Thank you. It is such a pleasure, Felice, Talia, Christina Delaney. I want to thank the other organizers for inviting me to speak about, I was asked to speak about sort of research, an update on research in postpartum psychosis. And I couldn't imagine actually talking about research questions in postpartum psychosis without just sort of framing a little bit about what I do and my colleagues do at Mass General. I've been at MGH for over 25 years and have been involved in the care of psychiatrically ill, pregnant and postpartum women across that period of time. And as a group of about 15 psychiatrists and flanked by social workers and also clinical research coordinators, we do about 800 to 1,000 consults a year for women who are either planning to get pregnant or who are pregnant or who are postpartum, who also suffer from psychiatric disorders. And our goals across the last 25 years has been to mitigate suffering associated with perinatal psychiatric illness. And you know, I'm so pleased to have had a chance across my career to pursue research in postpartum psychiatric illness, including postpartum psychosis. But I also think that the cornerstone of our work really is clinical care of patients, because it's really the clinical care of patients that, in my mind, provides us with the questions, the research questions that we want to pursue in various studies and that we've been doing going back, frankly, multiple decades now. And so I'm going to share with you in a way some new research initiatives in which we're involved, and also share with you what I think are some of the critical unanswered research questions in the area of postpartum psychiatric illness and specifically postpartum psychosis. You know, when I think about taking care of postpartum women, whether they have a non-psychotic postpartum depression or postpartum psychosis, I remember giving a talk pre-COVID at one of the PSI conferences, and I can think of almost no population where it so takes a village to get women and to get our patients well, and to see that we're responding to the various needs that women have. And I think that that's particularly the case when we take care of women with postpartum psychiatric illness, and particularly with in women who are suffering in a way the most severe form of postpartum psychiatric illness, which is postpartum psychosis, at least in my opinion. Let me share my screen and I think, and again, this just sort of highlights, you know, how far we've come. I want to start with this slide because from a historical perspective, and as I think about how much has gone in terms of our partnership and the energy of our colleagues in the advocacy space to come up with something like Postpartum Psychosis Awareness Day. I just can't emphasize it enough. And so before we talk about research, we really have to sort of applaud the efforts that sort of brought us to this sort of panel, and let alone the spectrum of material that's being provided across Postpartum Psychosis Awareness Day. And so let me just, I'm going to just say, I'm not going to talk much about postpartum psychosis clinically, but it's not a particularly common illness. It has dramatic experience and dramatic consequences for women who experience postpartum psychosis, but it is about 1 to 2 per 1,000 pregnancies. It typically has a rapid and dramatic onset, most often within the first 2 weeks, but it can be later. And we know that it's an illness where has probably the greatest risk of harm to both the patient and her infant. And I'll talk a little bit more, but I'm not sure that it's a productive debate. When you go to academic meetings, there'll be these debates, and when you go over to the UK, particularly about whether postpartum psychosis is absolutely indistinguishable from bipolar disorder, or whether it's a discrete diagnostic entity. From a research point of view, you can go to meetings where there'll be these very hot debates about sort of diagnostically what postpartum psychosis is and is not. But I think sometimes we miss perhaps one of the most critical pieces, which is, at the end of the day, the most important piece is that women get effective treatment for postpartum psychosis, and that we pull together the resources, both in terms of whether you're a perinatal psychiatrist or community-based support person, or leveraging some of the many resources that have been talked about today as we support women who are experiencing postpartum psychosis. So let me talk about, in my mind, sort of the most outstanding research questions that we have in the area of postpartum psychosis. There's still a question about what's the most common presentation? What are symptoms that you see most often in women with postpartum psychosis when you look at large groups of women? And is it one disease, or is it perhaps along a spectrum? And when we talk about patients who are acutely ill, what is the most effective treatment? When I went to a PSI meeting several years ago, pre-COVID, and spoke to survivors, spoke to patients with lived experience, what I really learned as I spoke with women from across America who had experienced postpartum psychosis is that there was disappointment and there was concern about, in a way, a lack of expertise and knowledge about how to best and most effectively manage postpartum psychosis acutely when those women were in hospital. And there are other questions. How long should patients be treated? And should different patients be treated for different periods of time? What we do know is, and this has been supported in multiple research studies, both in America, the UK, and globally, is that postpartum psychosis is a highly recurrent illness. For women who've had an episode of postpartum psychosis, in the absence of treatment prophylactically to sort of protect against another episode, women run about a 75 to 90% chance of recurrence. And so we're very interested in what we can do to mitigate risk for women having that experience again if they've had a previous episode of postpartum psychosis. And there have been multiple studies and even some recent studies to try to better understand, to try to capture what are the most common symptoms. And what you see in this graphic is a study done by some other colleagues who looked at the sort of spectrum of symptoms. And I'll talk a little bit about our own work at Mass General, where we are putting together a very rigorously configured cohort of women who've had histories of postpartum psychosis, where we do very in-depth interviews to understand the spectrum of symptoms that women experience. And there have been other colleagues who have looked at diagnostically and clinically, what are the symptoms with which women are presenting? And it's very well established that many women with postpartum psychosis will present with symptoms that are indistinguishable from a manic episode. And we treat those patients accordingly, typically in hospital. And others who will present with depressive symptoms or somewhat atypical symptoms. It's an opportunity, and I speak as a clinician and a clinician researcher, that because of the severity of this illness, it is very unusual. In fact, I don't want to say it's unfathomable, but it is hard to imagine appropriate acute clinical care not happening in hospital. This is a disease which is serious and which really needs to be aggressively managed, and where we must really secure the safety of both the mom and the infant. And so I know that it's variable across different clinical settings, even whether it's in America or the UK, about whether postpartum psychosis can be managed as an outpatient, but that would be very unusual, at least in our center, where women presenting with postpartum psychosis are typically hospitalized so that we can treat them most effectively and also in the safest environment acutely. I'm going to say a little bit about a project we got started with now several years ago. It's the Mass General Hospital Postpartum Psychosis Project. You can find this at the website mghp3.org. And by the way, everything that I'm speaking about with respect to our center and the work that we do on the clinical side and on the research side is available at womensmentalhealth.org. Womensmentalhealth.org, we get about 2 million views a year. We have about over 9,000 subscribers to our blog. Really, it's an enormous information resource, because I think it became very challenging for patients as we sort of navigate the ever expanding amount of information that's available, whether you're talking about scientifically in scientific journals or that comes up in the lay press or in social media platforms. Very tough to navigate that, to tease apart the take-home message, let alone what is good science or what is where there's an evidence-based supporting a particular impression clinically. And so I welcome people to visit us at womensmentalhealth.org. I was approached by a grateful patient several years ago and was asked if we received philanthropic support, was there an area that I wanted to study and in which I was invested? And I thought that here in America, we had incomplete research in the area of postpartum psychosis. So we set up the MGH Postpartum Psychosis Project, and I'll describe that to you. And this is a little bit of a busy slide, but basically we enroll in a very systematic way. We partner with our colleagues in the advocacy space and enroll women with histories of postpartum psychosis and do very in-depth interviews about their experience with postpartum psychosis, what symptoms they had, what treatment they had, how long they were treated. We get a very, very elaborate description, and we also ask them to tell their stories. And so we have what we call sort of quantitative data, and we have qualitative data. You know, people will ask still, and I think we don't have a good answer, what causes postpartum psychosis? And people sort of, like we talked about with postpartum depression years ago, to what extent is it hormonally driven? Are there other vulnerabilities neurobiologically that drive women to develop postpartum psychosis? And so we are using modern technology to not only look in a descriptive way, but also to look at the level of genetics, at the genome, where we're getting samples of women's DNA, and these are women from across America who we send little kits, and they're kind enough to send us back saliva samples, and we're trying to see is there a genetic or genomic underpinning to that vulnerability to postpartum psychosis. And then recently, we've been collaborating with colleagues also at Mass General who are experts in neuroimaging to see, is there a difference in the neuroimaging space in terms of vulnerabilities in women who, if you look at their MRI scans, do you see differences at the level of the MRI in women with histories of postpartum psychosis compared to women who delivered and who never had histories of postpartum psychosis, and also women who have histories of bipolar disorder. And that was actually also funded by a grateful patient, because in the era of genomics and in the era of doing really elegant neuroimaging studies with better and better technology, we were looking to see, is there a neuroanatomic signature for postpartum psychosis? This is just a slide to show you about when we talk about recruiting for an illness that's not very common, and obviously is huge sequelae and for the experience of women, but where we have to do a broad reach to recruit for an illness like postpartum psychosis. The partnership that we've had with our colleagues in the advocacy space has been huge. And so we have enrolled women from everything from Biloxi, Mississippi to Wisconsin, to the West Coast, to the East Coast, to the Bronx in New York. And we've partnered with some of the various social media, our colleagues in the social media space and social media platforms, to see if we can enroll. And we've been very successful enrolling this growing cohort of women with postpartum psychosis. On mghp3.org, we feature real survivor stories. And I felt an obligation as I listened to the stories of women who had suffered from postpartum psychosis that frequently they asked, was there any way that one of our faculty could engage with a clinician in the community in Nebraska or in Texas, in rural Texas, to help guide our colleague in the treatment acutely of postpartum psychosis, or in follow-up of those patients when they went home. And so we set up a free consultation service by our faculty, and so it's not patient to doctor, but it's doctor to doctor across America, so that if we get a request for some help, that we're available to our colleagues as they're trying to manage women with postpartum psychosis. This is just a fancy slide that I'm not going to get terribly into, but it suggests some efforts that we're doing in our partnership with our colleagues who are experts in neuroimaging to see, are there areas in the brain that might be implicated in terms of in women with postpartum psychosis compared to women who do not have histories of postpartum psychosis. And so we are now engaging women who are traveling actually across America. This is a funded study. And so we pay for them to come to Boston with their and to get scanned by our colleagues to see if we can see, is there we know that in psychiatric disorders, there are certain changes that we may see in certain parts of the brain. Does that dovetail what we see in patients with postpartum psychosis? If we understood that, it may over time allow us to partner with others in the area of treatment. Could it help? If you knew sort of where the problem was, would it help you tailor sort of targeted therapies for postpartum psychosis? Will we see precision medicine, as it were, in the area of postpartum psychosis? And so I'm going to sort of finish by sort of sharing with you what I think are some learned lessons in this space, which is that I think even in the areas that we don't have complete data, it does not preclude effective identification and clinically effective and safe referral and treatment of postpartum psychosis. What I've learned over 25 years is this is an exquisitely treatable illness where we can mitigate acute suffering and where we can get patients well and keep patients well. I think that whether we argue about how long we should treat, should it be until the patient doesn't have symptoms, or are some patients best suited with a longer period of treatment? I think those are unanswered questions, but I think that we are on our way to answering those questions. I think that the question of prophylaxis against recurrence of postpartum psychosis, as I mentioned in my earliest moments of this presentation, I think is clear. There is unequivocal support that if women have had a history of postpartum psychosis, even if they recover, even if they're not on medicines to follow, if they have another child, that using prophylactic medicine is a way of dramatically mitigating and reducing risk of having another episode. And lastly, and not to be redundant, but I think it's the most important message, whether you're talking about clinical care or research, is that postpartum psychosis is exquisitely treatable, and the morbidity can be limited if patients and clinicians are empowered with the appropriate resources that have been described during this panel, and information regarding best practices. And again, it takes a village. We need to have sort of boots on the ground folks in the community, support groups, and our colleagues taking care of patients need to be informed about best practices. Thanks so much. Here's the website for womensmentalhealth.org and also the MGH Postpartum Psychosis Project website. And Felice, I'm going to stop sharing my screen and go from there. Thank you so much for inviting me again.
Thank you so much. That was really, really educational and inspiring. So we have 7 minutes left on our panel, and I saw a few questions come in the chat, and we want to have time for questions and discussion. Maybe we could just start with this one I see at the bottom. And we also have Dr. Sally on the chat. So if folks in the audience have questions for her, I think that is feasible right now. I'm going to just read them in the order I see them. So question to Dr. Cohen and Dr. Wilson: to what extent is there scientific collaboration between the UK and the USA and further international research collaboration?
It's a great question. And so, a long time ally and supporter in the UK has been my colleague Ian Jones at the University of Cardiff, a very, very highly regarded figure in this space. My goal for the future would be, because this is a rare illness, we need to sort of take a page out of the playbook of for example, the psychiatric geneticists who have set up global consortium, and we don't have that in the postpartum psychosis space to date. So I think it's a spot-on question. And so yes, there's collaboration, and we talk at meetings, and the research dovetails, but if the question is, do we have to date sort of a global effort in the area of postpartum psychosis research? The answer is not yet, but hopefully not before too long.
Thanks. I know that was occurring to me as I was seeing all of the APP resources and knowing that some of those are things we've talked about here, that how could we be sharing more and collaborating more? So the next question says, what about PMDD? Is that being included in research?
So that's a terrific question, and wasn't the focus of this particular talk. For those folks who don't know what PMDD is, it's premenstrual dysphoric disorder. It's patients who experience worsening mood during the latter phase of the menstrual cycle. We've spent the last 25 years as well with a subgroup within our division studying premenstrual dysphoric disorder. What we're very interested actually in is in women who actually have a mood disorder if you see premenstrual worsening, which is actually quite common. And so, there's not a literature about a relationship between premenstrual dysphoric disorder and postpartum psychosis, but clearly, there's a very substantial literature about premenstrual worsening of mood in women who have underlying mood and anxiety disorders.
And Dr. Cohen, can you clarify, is that a risk factor for perinatal psychosis, being someone who has that sensitivity to hormonal fluctuations?
So that's a fantastic question. And so it has not been systematically studied. So are women who have a vulnerability to, for example, if they have mood symptoms as a function of being sensitive to changes in reproductive hormone environment, are they more at risk for postpartum psychosis? There's a suggestion that may put patients at risk for postpartum depression. It hasn't really been studied systematically for postpartum psychosis, but I think it raises such a important point, which is that we know we did a study years and years ago where we showed that women with the chief complaint of PMS symptoms, about half of those women had an underlying mood or an anxiety disorder when we did a structured clinical interview. And so I would want to make sure that women with the symptoms of PMS did not have bipolar disorder. Most do not, but because we do know that there's a very strong relationship between women with bipolar disorder and risk for postpartum psychosis.
Right. Okay. Another question from Sharon says, do you think there are situation-induced psychoses which are related to prolonged sleep deprivation?
It's a fantastic question. The answer is yes. We see, month to month or over the course of our rounds, we round as a group every week on Wednesdays. We have forever. That we get one of the faculty will present a case of, in the setting of profound sleep deprivation, that a woman will become transiently psychotic. We always worry and we want to make sure that that patient does not have bipolar disorder, because sleep deprivation can also induce, can unmask bipolar disorder. But if you asked me, have I seen over my career in the setting of, it's not like being an intern in medicine where you're on call one night and then the next night you sleep. When you're a new parent, it's night after night after night. And in the setting of profound sleep deprivation, patients can get psychotic and it can be transient. And so I hope that that answered the question.
I think so. It looks like we have 1 minute left, and I am going to read you one more question, and I apologize for any that we don't get to. This one says, can having high postnatal anxiety lead to psychosis?
So these are just such wonderful research questions. We are increasingly interested in postpartum anxiety. If you asked me, what's the sort of in the spectrum of postpartum psychiatric illness, where is sort of the understudied area? And it's in postpartum anxiety disorders. And because postpartum anxiety so mingles with depression, and so I can say that we very frequently see in patients with postpartum psychosis commingling of postpartum anxiety symptoms. I'll say lastly, because I think it's the take home, which is also one of the strongest predictors of what happens postpartum, is what happens during pregnancy. So we're very aggressive about seeing that women stay emotionally well during pregnancy, whether it be with respect to their mood symptoms or their anxiety symptoms, because that does lower your risk for postpartum worsening of mood and anxiety, and including postpartum psychosis.
Thank you. All right, so we are at the hour. I think we could have asked questions all day. And Talia and Sally, I want to extend a great thank you to both of you, and Dr. Cohen, Lee, to you for being a part of this panel. It's an important angle on the topic of what are the resources available and what are the big questions guiding the research for the future resources, right? So that there can be even more available and we understand better who to help, how to help, where the needs are. And I think that was, Talia, your talk really got at that, and Dr. Cohen, yours, and everybody just kind of came at it from a different perspective, which I love, because there are endless perspectives to any problem. And Christina, we all have deep, deep gratitude to you for having this idea, and I can't imagine the amount of work that went into making this happen. So truly grateful for that. Thank you, everybody, for joining. And I think that unless Christina has an announcement, this is the end of our panel.
Nope, that'll conclude the panel. Thank you all for joining us, and I hope you'll wear purple, tag us, share us today, and donate if you can. Thank you all.
Thank you. Have a great weekend, everyone.
Thanks, everyone.
Thanks, everyone. Bye.